Hi, have a good day. My name is Dixie Galvez. Today is April 2000. This month is April 2021. Um, what I have to do, my kids is asking about me about the vaccination, why it's so important. Even though the child does not know what's the meaning of all the vaccines that they gave it to them. Even a newborn child, he doesn't even know why she's being injected. All the infants knows that she feel the pain and poke needles into their body and cry, but he does not know. They don't know the meaning of the vaccination that they're doing to them in there. But the parents has to explain it to them why they're doing it to the children. The infants, when they inject, when you're born has a vaccination, all they feel is the pain. They do not know what's going on. So I didn't never heard about the school district Palm Beach County saying that you're not accepted to enter in the public schools if you don't have vaccination, but it's recommended. Okay, so some of my kids is asking, what now that they get older, they got 14 years old, 11 years old, they're asking why they have to be a vaccination. What is a mumps? What is Arabella? And what is the measles? That's what they're asking for, because all they feel is the pain and injected medicine into their body and poke a needle into all over their body. That's all they knows about it, but they do not know the meaning of everything. So some kids is asking on me what is a mumps. Okay, so the mumps is what we call that. They include also in the vaccination is MMR. Um, MMR combined separate vaccination. Okay, so what is MMR is? MMR is mumps, measles, and rubella. That's the meaning of M. Mumps, and the other M is measles, and the other R is rubella. That's the meaning. So what is mumps virus? It says in there that the reason why they have to be vaccination for the kids to protect them, that the disease and the virus can come to them. That's what that explained for the doctors. Okay, so the mumps is a viral infection that affects the salivary glands that easily preventable by a vaccine. Mumps affects the parotid glands, salivary glands below and in front of the ears. The disease spreads through infected saliva. Some people experience no symptoms. When symptoms occur, they include swollen, painful salivary glands, fever, headache, fatigue, and appetite loss. Okay, treatment focuses on symptom relief. Recovery takes about 2 weeks. The disease can be prevented by the MMR vaccine. So I explained it to you before what is MMR. So MMR vaccines means mumps, measles, and rubella. So we're talking about mumps just right now, the meaning of the other M. Okay, so that's the meaning. So mumps is a contagious disease caused by a virus that spreads from person to person. Typically, symptoms of mumps include swollen salivary glands and fever. Okay, mumps. So that's the meaning of the mumps. For all the children in school that does not know what's the meaning of it, because all they know is the why they have to be vaccinations, because they don't explain that. But the parents has to explain to your own kids too. Okay, so that's the meaning of the mumps. So now we're talking about measles. Why the kids has to have a measles vaccines. Okay, so it's the same thing. Measles is a highly contagious illness caused by a virus that replicates in the nose and the throat of an infected child or adult. Then when someone with measles coughs, sneezes, or talks, infected droplets spray into the ear, where other people can inhale them. So that's the meaning of the measles. That's include MMR. I explained to you what is the meaning of the mumps before. Mumps means MU. The spelling of the words mumps is MUMPS, mumps. So that's the spelling. So make sure you correct the spelling. Not a mommy, not a mom. It's a mumps. Okay, so the measles is a viral infection that's serious for small children but is easily preventable by a vaccine. So that's the reason why they get the vaccination for the children, even starting in the newborn, so that disease and the germs that cause on all these diseases thing cannot come to you. Okay, so the disease spreads through the air by respiratory droplets produced from coughing or sneezing. Measles symptoms don't appear until 10 to 14 days after exposure. They include cough, runny nose, inflamed eyes, sore throat, fever, and a red blotchy skin rash. There's no treatment to get rid of an established measles infection, but over-the-counter fever reduces or vitamin A may help with symptoms. One out of every 1,000 measles, that's the meaning of the measles that I read it before. Okay, so 1 out of every 1,000 measles cases progresses to acute encephalitis, which often result in permanent brain damage. 1 to 3 out of every 1,000 children who become infected with measles will die from respiratory and neurological complications. Okay, so my kids, when they were born infant, right before they got out in the hospital, a child has a vaccine. They already vaccinated, and then following the 6 months and then the other year until they go to school, and they have a record on it from the state of Florida. So measles causes symptoms and treatment. Measles is an infectious illness caused by the rubella virus. It spreads either through direct contact with a person who has the virus or through droplets in the air. So that's the cause and the causes and symptom and treatment. Measles is highly contagious viral disease that can be fatal. In most people, the disease produces fever and temperature. Okay, so now we already talking about the mumps, the MUMPS spelling words, and the measles. Now we're talking about what is rubella. Okay, so the rubella is a contagious viral infection preventable by a vaccine also, and best known by its distinctive red rash. The disease can spread through direct contact with the saliva or mucus of an infected person, or through the air by respiratory droplets produced from coughing or sneezing. Symptoms often appear 2 to 3 weeks after exposure and also include mild fever and headache. Rubella has been declared eliminated in the U.S. Parents are advised to vaccinate children with the MMR vaccine to prevent its emergence. So MMR, like I said, measles, mumps, and rubella. So that's the meaning of MMR and the vaccination of the state of Florida. So the children has all that record. Okay, rubella is a contagious cause of virus. Okay, so also the rubella is a contagious disease caused by a virus. Most people who get rubella usually have a mild illness with symptoms that can include a low-grade fever, sore throat, and a rash that starts on the face and spreads to the rest of the body. So that's the meaning of rubella. So all these diseases that come in the US, um, they should not be go to the children, because the children starts when they born, they come out in the hospital and they lab on them and they got the vaccination. So all the vaccinated that inject into their body, that's what I think, that when they get older, all these diseases, the children are immunization or immune, that they cannot, disease cannot come to them anymore. They cannot get sick. Okay, so now we finish about that MMR. Now we're talking about the vaccine of uh, HIV. Okay, so the HIV is the Haemophilus influenza type B vaccine, often called HIV vaccine. It's a vaccine used to prevent Haemophilus influenza type of infection. In countries that include it is a routine vaccine, rates of severe HIV infections have decreased more than 90%. Okay, so why should my child get the HIV shot? Protects your child from HIV disease, which can cause lifelong disability and be deadly. Protects your child from the most. Usually the HIV immunizations, kids aged 15 months or older who are receiving the vaccine for the first time only need one dose. Children aged 12 months to 59 months, almost 5 years old, may need more doses, and their immune system are weakened due to things like asplenia. So that's the reason why they get these kids about HIV. The vaccine provides long-term protections from Haemophilus influenza type B. Those who are immunized have protection against HIV, meningitis, or pneumonia, pericarditis, an infection of the membrane covering the heart, and infections of the blood, bones, and joints caused by the bacteria. So all of this, the kids already vaccinated on the school, before they enter to the school. So before they enter the school, the kids already completed their vaccination until they turn 18. Okay, so now we're already talking about the HIV. Now we're talking about um, what is hepatitis B. Hepatitis B vaccine is vaccine that prevents hepatitis B. The first dose is recommended within 24 hours of birth with either 2 or 3 more doses given after that. This includes those with poor immune function, such as from HIV or HIV, AIDS, and those born premature. Hepatitis B vaccine can prevent hepatitis B. Hepatitis B is a liver disease that can cause mild illness lasting a few weeks, or it can lead for you to death. So you need to be protected. That was recommended by CDC. Acute hepatitis B infection is a short-term illness that can lead to fever, fatigue, loss or appetite, nausea, vomiting, jaundice, yellow skin or eyes, dark urine, clay-colored bowel movements, and pain in the muscles, joints, and stomach. The chronic hepatitis B infection is a long-term illness that occurs when hepatitis B virus remains in a person's body. Most people who go on to develop chronic hepatitis B do not have symptoms, but it is still very serious and can lead to liver damage, cirrhosis, liver cancer, and death. Chronically infected people can spread hepatitis B virus to others even if they do not feel or look sick themselves. Hepatitis B is spread when blood, semen, or other body fluid infected with the hepatitis B virus enters the body of a person who is not infected. People can become infected through birth. If a mother has hepatitis B, her baby can become infected. So if the mother has hepatitis B, then the child gets sick too because the child is on the womb of the mother. So if the mother is sick, the child will sick. Sharing items such as razors or toothbrushes with an infected person, contact with the blood or open sores of an infected person, and sex with an infected partner that has a disease, and sharing needles, syringes, or other drug injection equipment, exposure to blood from needles, sticks, or other sharp instruments. So all of these things has to be avoided from the hepatitis B. Infants should get the first dose on okay, so that infants, they get that vaccination all the time in the hospital. It's recommended. Well, that's what the meaning of all the vaccination, because kids doesn't really know what's the meaning, why they have to be vaccinated, because they don't explain it to you. They just give you a needles and inject into your body. But the parents should explain it to them, and the doctor, they don't really explain it to you why they get injection. But even if you explain, the child doesn't understand that because it's just a kid. They doesn't even know how to read and write yet. And she doesn't, all she feel is pain they inject into their body, but they do not know what's the meaning on it. So if hepatitis B vaccine is also recommended for certain unvaccinated adults. Okay, so the people whose sex partners have hepatitis B, sexually active person who are not in long-term monogamous relationship, and if the person is having sex to the other person and has a disease and hepatitis B and gets sick, and then the partners get sick too, because this is a virus. This is a virus disease, so that's why they need to be vaccinated to avoid, and the disease cannot come to you. I think that's the purpose. Okay, so now we're talking about what the polio. Okay, so what is the hepatitis? Let me see. What is a polio vaccine? What is polio vaccine called? They call it inactivated polio vaccine, or IPV. That's the meaning of inactivated polio vaccine, or IPV. Is the only polio vaccine that has been given in the United States since 2000. IPV is given by shot in the leg or arm. Depending on the patient's age, oral polio vaccine, OPV, is used in other countries. CDC recommends that children get 4 doses of polio vaccines. Polio can be prevented with vaccine. Inactivated polio vaccine, IPV, is the only polio vaccine that has been given in the United States since 2000. Okay, so what is okay? So now we're all talking about that polio. Now we're talking about the DTaP, or DTaP, DTB, or DT. Okay, so those are included for the vaccine. They inject on you in the body, but really the parents doesn't know where is all those medicine came from. that the doctor gave it to you. Um, we don't really know where they came from and how did they make it to inject to the children, to the adult, on the body, on their vaccination, because they don't explain it to you. They don't, where they came from and how they make it. They mix with water or what. But that's all the meaning of it. If you want to be educated. So what are the two types of polio vaccines? Okay, so now we already finished that. So we're going to what is a DTaP polio vaccine? Okay, so what is DTaP? Okay, so DTaP means diphtheria, tetanus, and acellular pertussis vaccine, also known as DTaP. So that's the meaning of DTaP. Diphtheria, tetanus, acellular, and then P is pertussis, DTaP, DTaP, DTaP. Okay, so combined with inactivated poliovirus vaccine, also known as IPV, is a combination vaccine that is given to protect against infections caused by diphtheria, tetanus, lockjaw, pertussis, whooping cough, and poliovirus. They are together. They are a combination. A polio can be okay, so polio vaccination, polio or poliomyelitis is a crippling and potentially deadly disease. It is caused by the poliovirus. The virus spreads from person to person and can invade an infected person's brain and spinal cord, causing paralysis. You cannot move parts of a part of your body. That's a polio vaccine. Okay, so if you got a polio vaccine, that's the meaning of the polio vaccine. It's causing the virus spread from person to person and can invade an infected person's brain and spinal cord, and it cause into paralysis and cannot move parts of your body. So polio can be prevented with vaccine. Inactivated polio vaccine, or IPV, is the only polio vaccine that has been given in the United States since 2000. It is given by shot in the arm or leg. Depending on the person, since oral polio vaccines, OPV is used in our countries. CDC recommended that children get 4 doses of polio vaccine. They should get 1 dose at each of the following ages. So 2 months old, 4 months old, 6 through 18 months old, and 4 through 6 years old. So by the time they enter the school, the children has already completed their vaccination. Almost all children, in 99 out of 100 who get all the recommended doses of polio vaccines, will be protected from polio. The first polio vaccine was available in the United States in 1955. Thanks to widespread use of polio vaccines, the United States has been polio-free since 1979. So since 1979, the polio it's free since 1970, but poliovirus is still a threat in some countries. It takes only one traveler with polio to bring the disease into the United States. The best way to keep the United States polio-free is to maintain high immunity protection in the U.S. populations against polio through vaccines. So that's the meaning of DTaP. Okay, so now we're talking about what is tetanus. So you know the meaning. So the children knows what's the meaning of all of it. Okay, so the tetanus vaccination. The meaning of vaccines of tetanus are available that can help prevent tetanus and infected caused by Clostridium tetani bacteria. 4 kinds of vaccine used today protect against tetanus, all which also protect against other disease. Okay, so they have some Florida certification of immunization that was not listed in the vaccination, but is still giving to the doctor anyway when the children turn into teenager. Oh, yeah, because there in my kids they have some vaccination that was not listed in the in Florida certification mission in the state of Florida in the health department. It's called that Paloma virus. They don't put that in here. So all they put in here is the important thing, pneumococcal vaccines. Okay, so what is pneumococcal vaccine? It's a Streptococcus pneumoniae or pneumococcus is a gram-positive spherical bacteria alpha hemolytic or beta hemolytic facultative anaerobic member of the genus Streptococcus. They are usually found in the pairs and do not form spores and are non-motile. Is cause of the bacteria also. So all of these are already given to the immunization health department clinic for the children. So all this that they inject on the children's body when the time they get older, the disease cannot come to them already because they already vaccinated. So they were immune. Um, the pneumococcal disease causes, how it spreads, and how symptoms. Pneumococcal disease are bacterial infection that can affect the lungs and other parts of the body. Sometimes they can be serious but being treated. So, being some the other country died for all these diseases because they don't have a good vaccination since the children is born. But in the U.S., the children when they are in the hospital before they come out in the hospital and born, the children are already vaccinated. So when the time they become teenager, they already their immune system is already strong, not strong enough until they turn 18. So that's the meaning of it. Why they have vaccinated. I hope the children and my children can learn what I learned, and they know what's the meaning on it, why it's being vaccinated, even though I'm not vaccinated in that sense then in my country. um all right, so I hope you satisfied, and I hope I give you the right information, and be a learners. It's not too old to be a learners. Even if you're older, you still gonna be learn for everything, I think, and as long you're alive. All right, have a great day. Thank you for your paying attention. Have